Welcome. I'm Kelly O'Brien with Us Against Alzheimer's. We have a jam-packed agenda today. Hundreds of people are joining, and I'm really not surprised given the broad support for this issue that we've received from advocates and consumers and members of Congress across the country. Reducing the risk and someday hopefully preventing Alzheimer's is an important issue to so many of us. We're here to talk about an important new step in the fight against Alzheimer's, a step towards healthy aging. A decade ago, historic legislation sponsored by members of Congress on this call put in motion the development of a national strategic plan to fight Alzheimer's and related dementias. And just a few weeks ago, a new goal was added to this plan that aims to leverage what we know about the opportunity to reduce risk, delay onset, and someday perhaps even prevent this disease.
And when HHS Secretary Xavier Becerra announced that this new goal to promote healthy aging and reduce risk factors for dementia, he recognized in very personal terms that those at greatest risk of dementia are people of color and women. I'm Jason Resendez, Executive Director of the Us Against Alzheimer Center for Brain Health Equity, and I'm thrilled to join Kelly and all of you today as we celebrate this victory and outline a path forward that puts health equity front and center. This focus is critical given the impact of dementia on African American and Latino people, and will be necessary to ensuring that the promise of prevention can be recognized and realized by all communities.
So today we'll hear from many members of Congress, leaders in advocacy and health, and from you. And while we may not have time to take live questions, please do use the chat function. Submit comments, questions, and ideas throughout. We now want to turn the mic over to the founder and chairman of Us Against Alzheimer's, George Vredenberg.
Thank you all very much for being here. We have over 300 individuals and almost as many organizations represented on this call today. So December 26th is going to be remembered as an important date in the history of dementia and Alzheimer's. That's the date on which we added a new goal to our nation's strategic plan to end this disease. The goal is focused on action to promote healthy aging and reduce the risk factors for Alzheimer's disease and related dementia. It's one thing to announce a goal, it's the next thing to try and implement it. But we all have a role in promoting healthy aging and reducing the risk factors for not only Alzheimer's disease, but all of the diseases that affect our population. This is the first new goal in the Alzheimer's strategic plan since we started this thing in 2012 from the original NAPA goal. It's a testament to the impact that this kind of plan with clear goals can potentially have. When the National Alzheimer's Project Act, which we call NAPA inside the family, was introduced in Congress back in 2010, the objective was to set up an accountable path to prevent and treat Alzheimer's. Thanks to the leadership of the members of Congress that are with us today and many others who are committed to this cause, all investments in research to do exactly that, to prevent and treat Alzheimer's have increased nearly 600%. But that research has also demonstrated the capacity to prevent Alzheimer's through reducing a variety of risk factors, which I'll talk about in a second. But as Jason just highlighted, one of the things that the research or the experience over the last 10 years has made very, very visible and impactful is that there are vast gaps in the equity with which people have access to diagnostics, actually get diagnosed, and the care structure that we provide for Americans across the country. There's a disparity in the way the prevalence of this disease for women and communities of color. There's a lack of representation, adequate or reflective of our entire population in clinical trials. And the social determinants of health, lifelong efforts of education, of training, of the infrastructure for care and for research has systematically deprived people of color and low-income populations, not necessarily totally overlapping, but all of this plays a role in who gets dementia, who gets diagnosed with dementia, who gets treated with whatever stratagems and interventions we might have at any point in time, and how care is distributed around the population. And Sarah, specifically for leveraging the science and the recognition of the disparate impact of this disease and others on communities of color and low-income populations. But this prevention action adds another sort of quiver to the efforts that we have to prevent this disease. It adds a professional, a powerful message that there are concrete actions that people can take right now to reduce the risk of this disease. This new goal is reflective of the increasing awareness that if you reduce the prevalence of 10, 12 specific risk factors by 15% each decade, as many as 1.2 million fewer people would be living with Alzheimer's and related dementias by 2050. These risk factors everyone knows: depression, diabetes, hearing loss, midlife hypertension, physical inactivity, poor diet and obesity, poor sleep quality, tobacco and alcohol use, and traumatic brain injury, which itself can be the factor of a variety of sexual violence in our society, as well as racism. So this new goal also provides accountability. The Department of Health and Human Services is tasked with implementing the plan. A federal agency has been assigned responsibility for each provision of the plan to ensure the provision is implemented. And CDC has the responsibility for achieving this overall goal. Congress needs to provide oversight and must ensure that the administration has the resources it needs for this plan to be effective. This plan was accomplished because of you, a broad coalition of organizations across the public, private, and nonprofit sectors to focus on this particular reduction of a risk of Alzheimer's, but also for the more general effort to basically increase healthy aging, improve healthy aging. Many of you on this call, a broad and diverse community of advocates for social justice, healthcare, science, joined the movement. We're going to hear from some of our partners today, including the AARP and the American Heart Association and Balm and Gilead. Other organizations that help drive this policy include the American Federation of Teachers, Unidos US, the YMCA, Southern Leadership Conference, the American Public Health Association, the National Kidney Foundation, Volunteers of America. It just shows how broad and deep the challenge is, but also the energy and will to try and overcome it. These organizations and hundreds more have stood up and called for more action to promote healthy aging and reduce the risk of dementia. Many members of Congress, including those participating today, importantly, conveyed their support and urged that the plan be updated to include this goal. And so today, number one, we celebrate this victory for a moment and then begin the important work to achieve this new goal. So what do we need to do to achieve this goal? If we're going to get this done, we're going to need to continue to work together. We'll need measurable objectives to track progress, as we have with other goals in the plan. The National Advisory Council on Alzheimer's Research, Care, and Services noted that an aggressive 15% per year, per decade reduction in the above risk factors could result in as many as over 1 million people, fewer people with AD or Alzheimer's disease and related dementias by 2050. That's a place to start. Prioritizing health activity will be critical to achieving this new and necessary goal, as upwards of 40% of our population will become affected by this disease in the coming years. More engagement and input with those at greatest risk, reduced color, low-income populations, is needed in the NAPA process. We'll need engagement commitments and action from non-governmental organizations, all of us, and the private sector. NAPA was intended to be a national plan, not just a federal plan. We cannot rely alone on the inside the government plan, as important and critical and central as that is. But we also need an outside plan. We need payers, private payers, our health systems, such as hospitals, cities, counties, states, our employers, to be taking a closer look at risk reduction and asking the question, how can we help our nation achieve the goals set out in this new plan? How can we achieve it in our communities, in our states, in our health systems, in our education system, in our a variety of local and national efforts? We'll need to continue to support research at the National Institutes of Health. We need to drastically increase investments in public and community health. We should at least triple funding to 60 million for the Alzheimer's disease and healthy aging program within the CDC. To do this and more, Us Against Alzheimer's will convene a private sector or a private and NGO sector steering group to develop a collective action strategy. You're going to hear more about this in the coming weeks to basically lay out a potential organizational structure that can bring the rest of the country together with the federal government so that we collectively can advance this plan and achieve our goals. And so I say to you, thank you. Stay with us. There's work to be done, and we're not going to stop until prevention is possible and treatment a reality. We need to build this prevention effort into routine daily life and to the life of our health system, education system, and all aspects of our life course. Now I'm going to introduce my good friends from the Hill, starting with Debbie Stabenow. U.S. Senator Stabenow has made history in 2000. She became the first woman from Michigan elected to be in the United States Senate. Today, she's a national leader of the effort to make sure people have quality, affordable health care. Her bipartisan Change Act, introduced with Senator Capito, will give patients and their families new tools to cope with an Alzheimer's diagnosis. And she's a champion for Alzheimer's funding, which has increased sevenfold since 2011. She serves as a member of the Senate leadership and an important budget and finance committee member. She's one of the first to support the addition of this new goal. Thank you, Senator Stabenow. Senator Markey will follow Senator Stabenow. He leads the bipartisan Alzheimer's disease task force. He has, since 1999, been a champion for Alzheimer's as the convener of the bipartisan, bicameral Alzheimer's task force. He's an author of legislation that established the National Alzheimer's Plan a decade ago. Senator Markey also led the effort to support updating the national plan with this additional focus on prevention. And finally, on this string of 3 stars, Doris Matsui, senior member of the House Energy and Commerce Committee, co-chair of the Congressional Task Force on Aging and Families, one of the lead sponsors of the Change Act. She has led the effort in the House to push for updating the national plan with this additional focus on prevention. At the end of our session today, we'll have brief remarks from additional members of Congress, Senator Susan Collins, Senator Shelley Moore Capito, Senator Tina Smith, and Representative Darren LaHood, each incredible champions for the cause of ending Alzheimer's. This issue has strong bipartisan support. That is one reason I know we will succeed in ending this crisis for so many families. Debbie, thank you for joining us today, and I look forward to your comments.
Well, thank you so much. It is wonderful to be with you, as always, George, your efforts, and to be with my colleagues as well, to be with all of you, everyone with Us Against Alzheimer's. Thank you, thank you, thank you for everything you do every day, and all of the partners, the advocacy groups that are here on this call today. What you are doing is incredibly important work. We know that Alzheimer's disease is the 3rd leading cause of death in the United States behind heart disease and cancer. And as with heart disease and cancer, people can make healthy lifestyle changes to prevent Alzheimer's disease and dementia. We're learning more about that every day. So this is an important discussion, important victory that we're talking about today. I'm really pleased that the Department of Health and Human Services has strengthened its focus on prevention, and the fact that we now have a sixth goal to promote healthy aging and reduce risk factors for Alzheimer's. And in the Senate, I'm very pleased to have partnered with Senator Capito and Senator Markey to urge that Secretary Becerra make this change last year. And I'm so pleased that this is happening. And as George was saying, by meeting the plan's goals, we could see as many as 1.2 million fewer Americans living with Alzheimer's in 2050, which actually is not that long away. And that's going to require, though, important and lasting investments in public health and in health equity. Let me say it again, important investments in public health and health equity. And so that's something we all need to focus on and be committed to. You know, and let me also say that while the new focus on prevention is needed and welcome, we also have to continue to support people and families living with this heartbreaking disease right now. And that's the aim of the Change Act, our bipartisan legislation that I've introduced with Senator Capito in the Senate. And as we know, this helps ensure that we're screening for, detecting, diagnosing Alzheimer's at its earliest stages. We know more and more how important that is. And it creates incentives to promote detection and diagnosis and get patients the care that they need now. And let me close by saying it's also critical that we keep working together to fund research into breakthrough treatments that are safe and effective and affordable and accessible to patients. And ultimately, we have to continue our focus on beating this thing and finding a cure. So there's been a lot of progress made. I'm proud to be your partner in that effort on step by step by step. We've got a lot more to do, but it's not going to happen unless you continue to be involved. So thank you for your passion. Thank you for being not only on this call, but for you and the members that you represent being actively engaged every day. George, thank you and Us Against Alzheimer's. There has been great progress made, but we know so much more that we have left to do together. So I'm proud to be your partner, and I'm proud to have another partner. I'm going to turn it over to my great friend, a great champion, Senator Ed Markey. Ed?
Oh, thank you so much. Thank you, Debbie Stabenow, for the incredible leadership that you provide on this issue and so many others. You're just so great, and we're going to finish up Build Back Better as well. Just big achievements. That's who you are. And to to the others who are leading, Debbie, we have not just Debbie, but also Shelley Moore Capito, Doris Matsui, who is going to be joining us, who are standing up. And to you, George Freidenberg, thank you for your ongoing continued leadership on all of these issues, and to everyone who is joining us today. Thank you for what you're doing to provide critical advocacy on this absolutely essential issues. Like many of you today, I've experienced firsthand the loss caused by Alzheimer's. I lost my mother to Alzheimer's in 1998, 24 years ago. And I watched, as over more than a decade, my mother, slowly faded into a shadow of her former self. And I formed the Congressional Alzheimer's Task 23 years ago, 1 year after she passed away in 1999, bipartisan, so that we were working on a Democrat and Republican basis to advance the cause of research into this incredible scourge. And unfortunately, during George W. Bush's term, there were just massive cuts at the National Institute of Health's investment. And it was tragic, but we fought it. One year I was the only Democrat, the only person to actually vote against the NIH budget because it should have been going up instead of down. Well, we've had a tremendous change working since then to craft new laws to fundamentally change the trajectory of Alzheimer's research. Us Against Alzheimer's has done a big part in changing that trajectory so that there is much greater federal support for curing and preventing Alzheimer's disease. It's now been a decade since we worked on a bipartisan manner to enact the National Alzheimer's Project Act, which required the federal government to create a national plan for preventing and treating Alzheimer's by the year 2025. And then in 2014, I led in Congress in passing the Alzheimer's Accountability Act, which works with the 2020 law to require the National Institutes of Health to do a robust assessment of the resources and investments needed each year to meet this goal. And together, these bills have driven an historic increase in funding for Alzheimer's research. In fiscal year 2021 alone, Congress directed $3.1 billion for Alzheimer's research, more than 5 times the 2015 levels. And looking back to 2014, with the goal of dramatically increasing Alzheimer's funding for research by the year 2025, by the year that we set as the goal, there will be upwards of $30 billion that will have been spent over those years. And that's because of your advocacy, because you're working, because we got the 2014 law passed, and the Appropriations Committee each year gets the message from NIH, here's how much money we need in order to find the cure by 2025. And those funds have just helped improve our understanding of Alzheimer's disease, in particular, how to prevent it. And in the 3 years before 2015, fewer than 200 NIH-funded studies a year discussed risk factors for Alzheimer's. In 2021, more than 600 studies discussed risk factors for Alzheimer's. But I think we can all agree this is still not enough. We know that 40% of dementias are potentially preventable by better managing chronic diseases like hypertension and diabetes, reducing exposure to air pollution, promoting healthy lifestyle choices like increasing physical activity, improving nutrition, and quitting smoking. We must continue to talk about treatment, but we also must address these preventable causes in order to spare more than 1 million families from the tragedy of this disease. That's why Senator Stabenow and Senator Shelley Moore Capito and myself, Congresswoman Doris Matsui and others are calling on the Department of Health and Human Services last September to include a specific prevention goal in the national plan to address Alzheimer's disease. And I'm excited that the Biden administration heeded our call by including a prevention goal in their 2021 update to the national plan. But setting goals is easy, meeting them is harder. We will need to continue to invest in research into how we can best prevent Alzheimer's disease. And we must also address the social determinants of health that increase the risk of Alzheimer's, and that means ensuring access to healthcare and high quality education, improving air quality, and reducing poverty. We have seen in this pandemic how interrelated all of these environmental, economic, and social forces directly impact our health. If we are going to fully address Alzheimer's disease, we have to address the injustices that are present in our society. As we work to address these social determinants of health, we have to prioritize health equity. We know that Black Americans are twice as likely as whites to develop Alzheimer's, and Latinos, and are 1.5 times as likely in the Latino community. So that's just basically statistically inarguable. So our efforts have to prevent this disease, but focus on these populations who are at the greatest risk. So I want to thank all of you for being on this Zoom, who have helped to make our prevention goal a reality. Our goals are simple: prevent, treat, cure, and through it all, care. And I'm going to continue to be your partner in ensuring that we meet these goals. And now I am delighted to turn the meeting over to just my great friend, but a truly great Congresswoman from the state of California, Doris Matsui.
Thank you very much. Thank you very much, both Debbie and to Eddie Markey. And I really want to say good morning from Sacramento and to the good afternoon to everyone tuning in to the opposite coast and everywhere in between. It's so good to be with you here, all to celebrate the new Alzheimer's prevention goal and get motivated and excited about the important next steps we need to take to promote healthy aging and reduce the risk of dementia and Alzheimer's. I'd like to thank Us Against Alzheimer's for leading this effort. And I really want to thank so much my good friend, George Bradenberg, that has been on this journey for quite some time. And I want to thank you all, the hundreds of advocacy groups who together encourage the administration to include a focus on prevention and risk reduction. I was proud to amplify your message. In October, I wrote to the Biden administration urging HHS to establish an ambitious national prevention goal. It is clear to me that our work together had a collective influence, and I'd like to thank Secretary Becerra for heeding our call to action. We know that a significant percentage of dementia could be delayed and in some cases prevented altogether by early intervention. And that is why it was so important for the national plan to dedicate a new focus to proactively supporting brain health and reducing the burden of risk factors for this disease. So today, it is exciting to be able to celebrate this progress. Your voices, your advocacy, your perspective led to this achievement. Now, as we look forward to our next steps, we need to take the energy and engagement from this victory, take it with us to turn the prevention goal into meaningful, measurable action. With a clear prevention goal, we must now direct strategic investments and risk reduction and health equity that will benefit families, society, our economy, and the nation. Importantly, prevention strategies need to prioritize health equity. Understanding how social determinants impact risk factors will be critical to achieving this new and necessary goal. Now, the key to our next steps is continuing to hear from you. For Congress and the administration to understand what is happening on the ground, we need the perspective and input from those at greatest risk. Communities of color specifically need equitable representation of the national plan process. And we will need to really lean on NGOs, the private sector, and the public to ensure that our plan is meeting a national need. You know, across health systems, cities, counties, and our country, we all have a role to play in carrying out this national priority. There are so many at risk, so many now, our friends, our neighbors, and certainly our families. So now we must be taking a closer look at risk reduction. And by doing so, we help our nation achieve the ultimate goal to better prevent, treat, and put an end to the Alzheimer's pandemic. I want to thank you all for having me. I want to thank my colleagues. We're all in this together. And I look forward to our continued work together to advance these important issues. So thank you so much. I'm turning it back to George. Thank you, George.
Doris, Ed, and Debbie, you have been stalwart supporters of this movement Eddie back into 1999 and before, and Debbie over the entire period of your time in Congress, and the same with you, Doris. So you have really been our champions, and we deeply appreciate all of that, as well as your presence here today. So this is not just a federal government effort, as important as that is, but to actually turn nice puffy words into real action, we need a variety of partners in the private and nonprofit sectors. And we have three very outstanding leaders from those sectors here today. So I'm honored today to be joined by these three people who are all leading the nation and the world in a new way of thinking about how we age. Joanne Jenkins, the CEO of AARP, is challenging outdated beliefs about and introducing new solutions that respond to the new world we're in, where health, resilience, connectivity, opportunity, purposeness, and fulfillment define our later years. Is such a depressing phrase, but since I have been a member of AARP for quite a few decades now, I am a real fan of the AARP and of Joanne's leadership there. Second speaker in this section is Nancy Brown, the CEO of the American Heart Association, which is leading heart in ambitious mission itself. But she has also emphasized the relationship between the heart and the brain. A healthy brain contributes to a healthy heart, but whatever you do to, in fact, improve the health of your heart will improve the health of your brain. So these two, I think, comorbidities, so to speak, in a technical term, are intricately and intimately connected. So we're delighted to have her in this movement with us. And Pamela Price with Balm & Gilead has more than 20 years of experience in public health, epidemiology, and healthcare. In addition to her role as deputy director of the Balm & Gilead, she also serves as the director for National Brain Health Center for African Americans. Each and all of these leaders are working to ensure that we can all live and age healthy. And in fact, we look forward to working with them to actually structuring a private sector and NGO civic sector effort to bring the rest of society together with the federal government to make sustained, extensive, persistent, and equitable efforts to improve and improve our health and to reduce the risk of diseases of older Americans. So Joanne, thank you. I now turn the mic over to you.
So good afternoon, and thank you, George, for inviting me to participate in this important briefing today. We're proud to join with Us Against Alzheimer's and the Brain Health Partnership, not only to celebrate the adoption of this new national goal to delay the onset of Alzheimer's and related dementias, but more importantly, to develop a strategy to achieve that goal. You know, it's been almost 3 years ago when we convened the first meeting of the Brain Health Partnership advisors here at AARP. And the partnership, led by Us Against Alzheimer's, brought together a wide range of stakeholders and advocates to recommend a path forward in fighting against Alzheimer's and other related dementias. And we recognized at that time that while the scientists continue to fight to find a cure, we can't simply sit back and wait for that to happen. We need to work together to reduce the risk, to improve care, and to help people optimize their brain health as they age. And we had to work hard over these past 3 years to make that happen. You know, one of our priorities has been advocating for this new national goal focused on promoting healthy aging to reduce the risk and the delay of onset of Alzheimer's disease and other dementias. And last July, the National Alzheimer's Project Advisory Council unanimously recommended adding a goal to the NAPA plan to reduce the burden of risk factors, along with strategies for achieving that goal. Adding a risk reduction goal to our national plan will galvanize federal agencies to help us implement strategies to support healthy aging and better brain health, likely to result in fewer cases of dementia and improved quality of life for older Americans and their families. And I personally had the opportunity to discuss the goal with Secretary Becerra at AARP's Global Conference on Redefining Health in October of this past year, and urged him to add this goal to the national plan update and to prioritize its implementation within HHS. So needless to say, as many members of Congress have already said, we were ecstatic when HHS announced in late December that it was going to adopt the national goal focused on promoting healthy aging to delay the onset of Alzheimer's disease and related dementias. HHS also laid out 6 sound strategies to achieve risk reduction for diseases which cause dementia. And these include accelerated research on the risk factors, facilitating translation of risk reduction findings in clinical practices, to accelerate public health action to address the risk factors, to expand interventions to reduce risk factors, manage chronic conditions, and improve well-being through the aging network, to address inequalities and inequities in the risk factors among marginalized populations, and to engage the public about ways to reduce risk factors. And this last goal is one that AARP has been working on for a long time. The Global Council on Brain Health has led the way on explaining to the public what those risk factors are since 2016. And our Staying Sharp platform helps all our members understand how to reduce risk based on the 6 pillars of brain health. So while we come together today to celebrate the adoption of this new national goal, we also recognize that we must now focus our efforts on how we can all work together to achieve the goal. When we met 3 years ago, I said that AARP is in this for the long haul, and we are. We're optimistic that dementia can be defeated, and we're committed to working with Us Against Alzheimer's and all of you to reduce the risk of dementia and empower people to live brain healthy lifestyles, support those who suffer from dementia and their caregivers, and ultimately to find a cure for Alzheimer's and related dementias. Together, we have built a strong foundation in our work to establish a public policy goal to reduce risk, strengthens that foundation even more. So we're ready to get started to get this job done. And now I'm delighted to turn the mic over to my colleague and good friend, Nancy Brown with the American Heart Association.
Thank you, Joanne. Always a pleasure to be part of any initiative with you and our wonderful friends at AARP. And I do want to thank George and Us Against Alzheimer's for their passionate leadership in supporting the national goal to treat and prevent Alzheimer's and related dementias. For nearly 100 years, scientific research and innovation have been the bedrock of the American Heart Association, and for decades, we have funded cutting-edge research to define and maintain brain health and prevent cognitive impairment. This is a focal point of our commitment to the heart and brain and its collective impact on overall health. On the basis of this research, there is long-standing evidence on how risk factors directly impact the brain and how we age. We are aligned with the hundreds of advocacy groups like those represented here today on preventing cognitive decline by addressing these risk factors, such as high blood pressure, diabetes, obesity, high cholesterol, physical inactivity, poor diet, smoking, depression, and more. Additionally, we believe that every person deserves an equal opportunity for a full and healthy life. As part of our 2024 impact goal, health equity is at the center of everything we do. As we address these risk factors, we must not forget that systemic health and social inequities have put racial and ethnic groups at increased risk. We must also be mindful that heart disease and Alzheimer's both affect women and men differently. This means that research must focus on both sex differences with an equity lens. We are committed to prevention and reducing and improving risk factors for all. This is only possible through powerful partnerships, prioritizing health equity, addressing public and community health, and advocating for research and increased funding. This work is paramount to achieving our mission and support of the government's bold goal to reduce the risk of Alzheimer's disease. As an example of powerful prevention partnership is our work with the federal government to address hypertension in 350 federally qualified health centers in at-risk communities across the country. Our focus is to elevate quality care, provide education, and improve patient engagement. Powerful partnerships are also essential in research. In fact, the American Heart Association, Paul Allen's Frontiers Group, and others have committed tens of millions of dollars to improve brain health and treat cognitive disorders. These diseases are costly both to our healthcare system and to patients and their families in terms of personal and emotional toll. What gets measured gets done, and that's why data and metrics are foundational to public and community health. The American Heart Association and the Gates Ventures is funding a new research center and global data exchange. The goal is to accelerate scientific advances and improve brain health and reduce dementia. Public health leads to public policy. Legislative and regulatory priorities are great opportunities to address major risk factors for chronic diseases, including Alzheimer's. For example, the American Heart Association supports strong FDA regulation of all tobacco products and robust federal funding for prevention and cessation efforts. Additionally, we strongly advocate for increased research funding from the NIH to improve brain health and cardiovascular health. We also co-lead the National Physical Activity Alliance to impact policy and system changes so all Americans can enjoy physically active lives, a major prevention measure for healthy brains and aging. As I mentioned at the start, together we have a lot of work to do, but through the power of collaboration, partnerships, and advocacy, we can make a difference to achieve the national goal to treat and prevent Alzheimer's and related dementias. And we are so honored to be part of this amazing movement to make just that happen. And now I'm delighted to turn the mic over to Pamela Price with the Balm in Gilead. Pamela?
Hi, thank you so much again to Nancy and to Joanne. Thank you, George, and to the entire Us Against Alzheimer's team. We have been honored and proud to serve alongside you as a partner. For more than 33 years, the Balm in Gilead has served in the role of bridging the gap between those most vulnerable communities, the African-American communities, those marginalized communities that we've all talked about throughout today's session, and bridging that to public health, bridging that to research, bridging that to government and other federal organizations, all the way back from starting its National Week of Prayer in Harlem to our work with our Healthy Churches National Conference and Initiative. We fully support the addition of this plan that is looking at the prevention and risk reduction related to Alzheimer's and dementia. As it's already been stated, a lot of that is in connection to a lot of the comorbidities that these marginalized communities are already burdened and disproportionately impacted by, from diabetes to high blood pressure to heart disease. And much as already has been said as well in terms of having the plan is great, but it's the execution, it's the implementation, it's the actual action that must take place so that our communities can benefit from all of the great work that our legislators have done, that other advocates and other organizations who are on this call as well have long been fighting for. But as has been stated, our work is not done, and there's a lot of work to continue to be done. We have been working to leverage our networks into these communities, into actually where individuals are living, where they work, where they play. And while we can stand in the gap, and we know the importance of getting individuals into clinical trials, we know the importance of having to address these health equities, we have to make sure that that becomes the common thread between our work going forward. That we are looking at both the socioeconomic impacts that not just the burden of Alzheimer's and dementia has had, but as well as the other chronic diseases. We are still in the midst of a global pandemic. We still have much social unrest in our communities that we have to make sure that as we have move forward in this work, that we are willing not only to roll up our sleeves, but to have the difficult conversations, to actually really meet and understand where our communities are, how to move them forward in this conversation around healthy aging, and not only looking at it as a issue for us as we've already aged, but really looking at this as an intergenerational issue that requires all of our communities to come together, that requires all of our stakeholders to come together in this fight to not only look at preventing and reducing the risk that we have related to Alzheimer's and dementia, but really looking at the overall quality of life for every individual who is going to be impacted by this landmark, decision to include this additional prevention component to the NAPA plan. And so we are committed again to this partnership, committed to continuing the collaboration and continuing again to do the work to lift up the voices for so many of us and those in our families and communities who have been impacted by Alzheimer's and dementia, but who are ready and willing to see again more equitable health in this space. And so I again want to thank everyone for all of the work that has gone in putting today's conversation together, all of the work that has gone into getting us to this point to have this great plan that we can use it as a roadmap, if you will, as we move forward in this work. And so again, just want to thank everyone, commend Us Against Alzheimer's and George and their team, and happy now to turn it back over to Kelly. Thank you.
Pamela, thank you so much. And everyone, Nancy, Joanne, all of the partners, very grateful for your collaboration and support. This wouldn't have happened without you. I am now very honored to introduce Dr. Karen Hacker, Director of the Center for Disease Control and Prevention's National Center for Chronic Disease Prevention and Health Promotion. This is the public health epicenter for most of the dementia risk factors that we're talking about today. Karen has been a vocal advocate for and implementer of action steps to improve the social determinants of which Pam and others have spoken so eloquently about. These conditions where people live, work, and play that affect our health, our risk, and our outcomes. Dr. Hacker is here representing the administration today, and she will speak to us about why this goal is so important and the key strategies and next steps that the Secretary has outlined. Thanks, Dr. Hacker.
Thanks, Kelly. So hello, everyone, and I am so pleased to be here as the Director of the Center for Disease Control's National Center for Chronic Disease Prevention and Health Promotion. The Secretary of Health and Human Services, Secretary Becerra, sends his regrets that he is unable to join us today, but it's my great pleasure to represent the department. The National Alzheimer's Project Act, or NAPA, was signed into law in January 2011. It called for coordination across federal agencies to work to improve outcomes related to Alzheimer's disease. NAPA also required the creation of an advisory council and the development of an integrated national plan to overcome Alzheimer's disease. The national plan to address Alzheimer's disease was first released in May of 2012 and laid out 5 ambitious goals to guide federal efforts in addressing Alzheimer's disease and related dementias, also known as ADRD. In July 2021, the Advisory Council recommended that HHS add a 6th goal to the plan, which would focus on reducing the burden of risk factors, or ADRD. And after careful consideration of the evidence on risk reduction, and because risk reduction activities align so closely with our broader efforts to support healthy aging, HHS added a new goal in the 2021 update of the national plan. That's goal 6 that you're hearing about: accelerate action to promote healthy aging and reduce risk factors for ADRD. Goal 6 also aligns with addressing disparities and risk factors, including among different racial and ethnic groups, which is a priority that aligns with HHS's and the Biden-Harris administration's goals for advancing equity regarding Alzheimer's prevention. We are so excited to be here today discussing the plan and the new goal, goal 6, as you've heard. The goal is key to the CDC and the National Center for Chronic Disease and Health Promotion Strategies. CDC led the development of this goal, and we are happy to see its incorporation and rollout today. CDC is leading our nation's public health efforts to help older adults with dementia remain active, independent, and involved in their communities as long as possible. While Alzheimer's disease and related dementias cannot be prevented, we know there are several risk factors that we can work to reduce. The modifiable risk factors for Alzheimer's disease and related dementias include, and you've heard these already, depression, diabetes, hearing loss, midlife hypertension, physical inactivity, poor diet quality and obesity, poor sleep quality, sleep disorders, tobacco use, traumatic brain injury, and excessive alcohol use. These also promote healthy aging through the primary prevention of Alzheimer's disease and related dementias. Importantly, addressing inequities and risk factors for Alzheimer's disease and related dementias among historically marginalized populations and those disproportionately impacted is of critical importance in the federal efforts to address risk factors. Alzheimer's disease and dementia care and services vary widely across the country, depending on race, ethnicity, geography, and social and economic factors. Stigma, cultural differences, awareness, and understanding about Alzheimer's disease and related dementias can all be factors leading to health disparities. In addition, the ability for a person to even get a diagnosis or manage their disease and be able to access quality health care can contribute to health disparities. And these disparities reach beyond clinical care to include uneven representation of Black, Hispanic, Asian, and American Indian and Alaskan Natives in Alzheimer's research and in clinical trials. We know now that older adults who are Black, and you've heard this already, are twice as likely to have Alzheimer's disease as those who are white, and those who are Hispanic are about 1.5 times as likely. There's evidence that misdiagnosis of Alzheimer's and other dementias are more common among older Blacks and Hispanics than among older whites. And while we can't say that location causes Alzheimer's disease, we can say that the data shows counties with the highest prevalence tend to be negatively impacted by certain social determinants of health, such as having higher levels of poverty, fewer options for exercise, and less education. The new goal builds on the CDC's National Healthy Brain Initiative, which focuses on promoting brain health in populations with the highest prevalence of Alzheimer's disease and related dementias. And those include African American, Hispanic, American Indian, and Alaskan Native populations, and those who have intellectual and developmental disabilities. This funds several organizations, including Us Against Alzheimer's, the University of Chicago, and the International Association of Indigenous Americans. These organizations focus on populations at highest risk, including developing culturally specific materials. CDC also has the Building Our Largest Dementia Bold Infrastructure for Alzheimer's Act Awards that started in 2020 and accelerate and elevate risk reduction at both a national level and in specific jurisdictions. This includes the first Bold Public Health Center of Excellence on Dementia Risk Reduction that supports state, local, and tribal public health agencies to address modifiable risk factors for cognitive decline and dementia consistent with the best available scientific evidence. There are evidence-based interventions that promote healthy aging related to these risk factors, and they could make a substantial impact in promoting the health, well-being, and independence of older adults, while potentially reducing their risk for Alzheimer's disease and related dementias. We can promote healthy aging and reduce risk factors for Alzheimer's disease and related dementias. This year, the Bold Public Health Center of Excellence on Risk Reduction is going to host their first national meeting to establish and update priorities and milestones for addressing dementia risk factors. The meetings will engage a range of diverse stakeholders, including historically marginalized voices and communities, other federal agencies, state and local public health departments, health providers, educators and payers, community-based organizations, and private sector partners. Specific time-bound actions by public and private entities that advance the milestones will be identified. And this includes private and public partners outside the traditional Alzheimer's disease and related dementias community who focus on the targeted risk factors. To highlight CDC's commitment to support the work of the sixth goal, CDC anticipates funding a new prevention research center special interest project in FY22 to develop a new thematic network on risk reduction. These activities are designed to promote implementation of CDC's Healthy Brain Initiative state and local public health partnerships to address dementia, the 2018 to 2023 roadmap, and the Healthy Brain Initiative roadmap for Indian country, or the roadmap series, with a focus on equity and reducing disparities. The roadmap series charts a course for public health agencies and their partners to act quickly and strategically to prepare all communities to be dementia ready by stimulating changes in policies, systems, and environments. Many of the roadmap's 25 expert developed actions would accelerate risk reduction by promoting brain health. We can promote the healthy aging and reduce these risk factors for Alzheimer's disease and the related dementias. All of our efforts resonate with this new goal 6 of the national plan, and therefore you can understand how excited we are to move this agenda forward as both a leader and a partner. Thank you so much for your kind attention and continued commitment to reducing the prevalence of Alzheimer's disease risk factors. Thank you.
And thank you, Dr. Hacker, for your leadership in our national public health response to dementia and to ensuring equal opportunity and access to healthy aging. As many of our speakers highlight today, prioritizing health equity will be critical to achieving this new and necessary goal, not just because it's nice to say and something that people feel they have to say, but because driving health equity can help us get to the root of these issues that we've talked about. Scientific consensus is growing that social determinant factors contribute greatly to the higher risk of dementia among Latino and African American people. To quote Dr. Jennifer Manley, disparities are rooted in unnecessary and avoidable social injustices. We know from Us Against Alzheimer's research with the Urban Institute that US counties with the highest prevalence of dementia among Black and Latino Americans tend to be lower resourced than the counties with the least prevalence of dementia. Families in these counties tend to have lower incomes, higher levels of poverty, limited access to exercise, and lower levels of educational attainment. These factors underscore the importance of the new goal and its recognition for the first time of structural racism and inequality in shaping healthcare outcomes and access. And also its emphasis on community and system level investments to improve infrastructure to address the social determinants of health. This is not just an individual risk behavior issue. This is an issue of how we shape the conditions in which people live, work, and play, as Kelly highlighted. This goal makes clear that to ensure the promise of risk reduction is equally accessible to all families, we need to improve these conditions for public health in communities with a high risk of Alzheimer's and other dementias. To achieve this reality, we have to, 1, increase support for our public health response by expanding state-level coordination and capacity to share data, enhance and link health equity initiatives, and to better target resources to communities with a high burden of Alzheimer's and other dementias. We have to have a greater and more coordinated role with the private sector, as George highlighted. And importantly, we have to re-envision the NAPA process to include more expertise in the areas of health equity and community mobilization to better carry out the goal. The Us Against Alzheimer's Center for Brain Health Equity, which is partially supported by the CDC, can be a hub for this coordination, given our robust capacity to link data and mobilize social justice stakeholders around policies and interventions. We look forward to a strong collaboration with all of you to make this possible, and I'll turn it back over to Kelly.
Thanks, Jason. Thanks, everyone. So I just want to, before we move to some final remarks, some closing remarks from a number of additional members of Congress, after which will follow a brief close for myself and George. I wanted to be sure that we took a moment here to talk about what we can do about all of this and what the next steps are and how you can be a part of it. So there's 4 primary highlights that I want to mention. One is we do want to thank the administration and Secretary Becerra for adding the 6th goal. And we will be more than 200 organizations, including those on this call, had issued a call to action along with us asking for this goal. And we will be reissuing that letter as a thank you to the Secretary. We invite others to join us in that thanks. And we'll be sending that around after the call. Secondly, as many of the speakers have mentioned, including my colleague Jason, supporting increased funding for CDC's Chronic Disease Center is urgent and critical. It is not an exaggeration to say that they are funded on a shoestring to do the work that they need to do, facing the magnitude of the problem that we are facing. We strongly support increasing, at least tripling the budget for the Alzheimer's disease and healthy age program in particular. And we'll be increasing advocacy around this effort. We would welcome anyone and everyone who would like to join together to support this effort with us. And again, there'll be an opportunity to start that process through a letter that will be circulating after this call. Third, take a look at the HHS plan. I believe my colleague Daphne posted it in the chat. We'll send it around again, but take a look at that plan. Take a look at the council recommendation. And ask yourself, what can I do? What can my organization do? What am I doing? What are we doing? Consider how your work connects to this goal. Let us know how you can help. Add that in the chat. Follow up with us in the email that we send out. We need to collect the best thinking and convene the best and brightest organizations working in this space if we are to achieve this goal. And finally, last but definitely not least, as George mentioned, we absolutely plan to convene more strategically a coalition, a group of public, private, and NGO organizations to meet to talk about how we can together work to advance this work. It's not, as George mentioned, something that can entirely happen inside the government. There's a lot of work that needs to be done outside of government as well. We want to work together with you and get the best ideas and thinking around how we can move that forward. So look for more information from us about how you can be a part of this effort. And if you are interested in joining with us, please let us know in the chat or in follow-up email that we will send out. I'm sure there are many more ways that we can advance this goal. So again, welcome your ideas and best thinking and your partnership in all of this. I'm now going to turn this over to a number of remarks from additional members of Congress, Senator Capito, Senator Collins, Senator Smith, and Representative LaHood, after which we'll close with a short comment from our chairman, George. Thank you.
Hi, everyone. Thank you, George, for the kind introduction and for all that you and Us Against Alzheimer's continue to do on behalf of Alzheimer's advocacy and research in our country. For those of you who do not know me, I'm Senator Shelley Moore Capito, and I represent the great state of West Virginia. But Alzheimer's is a deeply personal issue to me, too. Both of my parents struggled with Alzheimer's before they passed away. As their primary caregiver, I personally know the heartbreak that Alzheimer's has on patients and families, and the barriers that this creates for our medical professionals. Because of this, I have worked and wanted to make sure that funding for Alzheimer's research remains at proper levels. I've also made sure that resources are delivered to the NIH to enhance our understanding and treatment of Alzheimer's and related diseases. Over the past several years, we have had many successes to move our advocacy forward. An example is the passage of the BOLD Act, and its implementation at the CDC helped cement the foundation needed to combat Alzheimer's disease and expand our research operations. Although we've come a long way in recent years, we sure have to keep going. Now, I know a big part of your virtual briefing this year is HHS's new Alzheimer's prevention goal. In October of this year, I led my colleagues in a letter encouraging Secretary Xavier Becerra to establish an ambitious national goal to prevent Alzheimer's disease and to develop a plan to achieve this goal. I'm glad to see the Secretary heeded our advice and is implementing those components into the national plan to address Alzheimer's disease. This will help promote healthy aging and encourages prevention of conditions often associated with Alzheimer's like hypertension, diabetes, and depression. I have consistently been an advocate for accelerated research on risk factors for Alzheimer's disease, and I'm glad to see this year's plan is in line with that as well. Although we have yet to discover a cure from Alzheimer's, the development of prevention strategies is major progress. In the meantime, I encourage you to continue fighting the good fight. And thank you again for all that you do, as difficult as it is. And I hope you have a great day.
Good afternoon. When George and Trish Fredenberg founded Us Against Alzheimer's, they mobilized people across the country to improve care and find a cure for this devastating disease. This is Trish's enduring legacy. Today, we celebrate an exciting new chapter. For the first time since the National Alzheimer's Project Act became law, a new goal has been added to our National Strategic Plan to end Alzheimer's. This initiative will help combat this disease by promoting healthy aging and reducing risk factors for Alzheimer's and related dementias. I've spoken with Secretary Becerra about the importance of prevention, and I appreciate his strong support for this new priority. More than a decade ago, I co-authored the National Alzheimer's Project Act that set the objective of preventing and effectively treating this disease by 2025. We have made some progress since then by implementing a coordinated strategic national plan, funding medical research at historic levels, and supporting family caregivers. Now we've added prevention. We know that healthy aging strategies such as regular exercise, good nutrition, and properly managing chronic conditions can lower the chances of developing the disease or delaying its onset. That's now been recognized in our national strategy. The new prevention goal specifically calls for clear strategies focused on risk reduction, and it will accelerate research on risk factors. We will better communicate and disseminate that research and turn findings into clinical practice. Fortunately, the U.S. is prepared to hit the ground running in implementing the prevention goal. In 2018, the BOLD Act, which I authored, established centers across the country to establish a public health approach to Alzheimer's. These centers are developing and disseminating new information to families on how to reduce the risk of getting the disease, particularly in communities of color that are disproportionately affected. In many ways, Alzheimer's is the defining disease of our generation. We must not let it define our children's generation as well. A focus on prevention, in addition to the national plan's original 5 goals, provides the key to saving lives and charting a brighter future. Thank you for all that you do.
Hi, I'm U.S. Senator Tina Smith. Thank you to Us Against Alzheimer's for all your work to advance treatment and prevention against Alzheimer's disease. And thank you to George for your huge commitment to this issue that is personal to so many of us. We lost my mom to Alzheimer's in 2016. As you all know, losing a loved one to Alzheimer's is a slow and painful goodbye. My mother was feisty and smart and full of energy and love, and I think about her every day. My family's experience with Alzheimer's is shared by so many. Over 5.8 million Americans live with the disease. Dementia is devastating, but studies show that more than a third of dementia cases could be prevented. We know now, for example, that high blood pressure, poor nutrition, and depression are risk factors for Alzheimer's disease later in life. So I am grateful for your advocacy to include prevention as an important part of a national strategy to address Alzheimer's. And I applaud the Biden administration for answering your call to focus on preventing Alzheimer's disease. By focusing on prevention, we can do a better job of coordinating national efforts around public health and identify and limit the risk factors that can lead to Alzheimer's by addressing them sooner. This approach can help save lives, and it can give us all hope. So thanks to the great work and advice of George and so many of you, I'm working in the Senate to get us to focus on prevention. And I'm fighting so that all Americans have access to high-quality health care that they can afford, including for mental health. So thank you for all your work and your vision to achieve a country without Alzheimer's. I'm proud to be your partner in this fight.
Hi, I'm Congressman Darren LaHood from the 18th District of Illinois, and it is a pleasure to join Us Against Alzheimer's Brain Health Partnership for a briefing on Alzheimer's prevention. I want to thank Us Against Alzheimer's for leading this effort and the hundreds of advocacy groups, including AARP, American Heart Association, the Association of Chronic Disease Directors, and organizations such as the Balm and Gilead, and others who together encourage the administration to include a focus on prevention and risk reduction. The new goal is important because it provides a framework with a specific goal and strategies for us to work towards. It provides accountability about the federal government should be doing on behalf of its citizens. In this case, working to reduce the prevalence of key risk factors like diabetes, depression, hearing loss, and more. As we all know too well, Alzheimer's disease is a growing public health crisis affecting a projected 14 million in the U.S. by 2050. As a longtime advocate and partner in the fight against dementia, I know the work supported by Us Against Alzheimer's and all of you is a critical tool to support research and caregiving for patients and their families. I am pleased to share an update with you on the work I have been doing in Congress, advocating for those impacted by dementia throughout the country and particularly at home in Illinois. In Congress, I have been privileged to support initiatives that increase funding for Alzheimer's research, investments in preventative care and early detection, and help for family caregivers. Individuals with dementia rely heavily on their family members or another caregiver to provide time, transportation, and other services, which can be economically and emotionally challenging for a family. In Illinois alone, we have over 381,000 caregivers for people living with dementia. I am the proud sponsor of H.R. 2517, the Comprehensive Care for Alzheimer's Act, and H.R. 3354, the Change Act. These two bills are key pieces of legislation that provide caregiver support, methods for early detection of dementia and Alzheimer's, and accelerate progress for disease-modifying treatments. Additionally, I led a bipartisan letter to the Department of Health and Human Services to develop a national goal to prevent Alzheimer's disease that prioritizes innovation, research support, and strategic investments in dementia care. As I travel throughout Illinois, dementia care and Alzheimer's advocates continue to share their powerful stories with me. I'm proud to be a leader of Alzheimer's advocacy and continue to work on ensuring high-quality health care for patients, families, and caregivers. I want to thank Us Against Alzheimer's for the invitation to speak to you today and the work they do. I will continue to support efforts in Congress that help us end Alzheimer's for good. Thank you.
I want very much to thank all of the members of Congress, all of whom have been terrific supporters of this effort and a number of other efforts in Alzheimer's. But we need to step up too, not just as advocates to government, but also as actors. So one of the great challenges in front of us is that can we marshal the kind of will and commitment to work together in the private and civic sectors with community-based organizations, with those that represent the communities that are most disparately impacted by this disease, to actually cause the private sector to focus much more intensely and comprehensively on the issues associated with risk reduction for Alzheimer's as part of the healthy aging strategy. It's a challenge to us. Some of you in the chat have said, you know, words are nice, but where's the action? Well, the action right now is the fact the United States government and its agencies in this space have committed to a national plan. So it's the nice words in the chat function for all of you. What is your action? What are you going to take to do to bring about this goal? So we will be organizing, you'll hear a lot more about this, a steering group that will organize on how to think about to do something very unusual, which is to bring across all the civic private sector players to this cause. Where are the hearing aid manufacturers? Where are the food companies that can deal with inadequate diet in certain communities around the country? Where is the Transportation and Housing Administration in terms of equalizing or at least dealing and recognizing with the social determinants of health? So we need to think together broadly, comprehensively, and nationally, locally, and to bring about change. This is hard. I mean, this is hard. We're trying to change the infrastructure and the systems which have created disparate impact across one's entire life in our society. And we're not going to be the only voice in that, even though we're dealing with the health issues. There are so many other issues that we need to work with other advocates and other agencies of government to address. So I don't want to make it so big that we can't do it. But I do want to make sure that all of you who are critical on the chat to the way we're looking at drugs or the way we're looking at prevention and the way we're just talking about it, we're not just talking about it. So I'm challenging all of you as organizations and as individuals as we begin to march down this path this year to think about how you can get involved or your organization can get involved or the sector in which you work can get involved. Because this problem is not just Alzheimer's. This problem is for all Americans of all stripes, of all communities, national and local and private sector and civic sector, community-based organizations. How do we marshal this force around a common goal to measure ourselves on how we're doing with respect to those that are experiencing these disease conditions, but also the impediments, the infrastructure, and the structural and system barriers to getting a brain health common, dealing with it in a common way, and a common system, and indeed with equity very much as heart of this. Because if we can get communities of color, low-income populations, and all of the various players, all of whom would agree on the goal, in an effort together, we can make change. And for those of us whose families have been deeply affected by Alzheimer's, or even myself who have heart disease and other conditions, we need to work across the disease space. We need to work across the national to local space, and we need to get community-based organizations as well as other departments of the federal government involved in these social determinants of health. Some of us have been very privileged or lucky in life for a variety of reasons. Others of us have not, but we're all Americans. We all care about everyone's health, not just our own. And so we need to put all of us the shoulder to the grindstone. That's a challenge that, of course, I've laid off on Kelly O'Brien to try and do. But we'll be working as an entire organization to try and bring some organizational approach to this, working with so many of you, hopefully deeply with AARP and the American Heart Association to bring this about. So thank you all for attending today. We have run over a bit, for which we apologize, but there were, as you've seen, a lot of speakers who are ready, willing, and able to join forces together to attack this problem of inequity and brain health simultaneously. So thank you. Have a great day. I look forward to working with all of you as we go forward.